mentioned earlier in the show that Biloela Hospital in central Queensland, gorgeous town of people. If you haven't been there, well, it's worth going. Biloela has now clocked up more than a year of maternity bypass. That means that if a country woman in that region has a baby on the way, the hospital that services the region is no longer able to offer them care. It means women are being expected to move to Rockhampton or Gladstone weeks before baby is due, leaving husbands, kids, the farm, other caring responsibilities in the lurch for no reason other than that Queensland Labor can't get its act together. And should baby be on the way earlier than that, well, it causes a world of trouble. Gladstone has only just come off bypass itself, while Rockhampton's maternity ward is bursting at the seams as it is asked to do the work of the entire rural maternity network for central Queensland. Here to update us on what all of this means is Alicia Staines from the Maternity Consumer Network. She's just all over it. Alicia, welcome. Please tell us, how are things going for rural maternal health in Queensland right now?
Yeah, you're right. We've certainly got Gladstone back online, but whilst Gladstone come back online just recently, so last week, Ingham's now a bit of a bypass, part-time bypass, I would say. So 2 and 4 or 4 and 2. So depending on what week you birth in, depends on whether you get the option to birth locally. So we've certainly not seen improvements. It's really devastating for these local women and families, how much impact this has. It's also trying to do the same thing and get a different result. Like, we know we can't get doctors, but we also know that there are ways around this by operating in a level 2 facility. So women get to birth there, and it's only the ones that need emergency care, so caesareans that transfer, instead of expecting all women to be travelling an hour or more across these roads, because some women actually can't leave their town. So we're expecting them to do this in labour. Certainly no improvements to report.
So what is this doing on a day-to-day basis for country mothers and babies?
Well, it's dangerous to start with, but it's also the uncertainty. So with Ingham, they don't know. So if I've got a due date tomorrow and yet the bypass starts tomorrow, I hope I have that baby today before bypass starts. So that's the issue there. Obviously, we've got a huge impact on having to relocate, and the uncertainty for women getting pregnant now. Do I know that I'm able to birth in my town? Like, are they going to sort this out in 9 months' time? And it's certainly, if we look at Biloela and what's happened in Theodore, Chinchilla, Cooktown, Weeper, it certainly doesn't look like a 9 months is enough of an incubation period to get these maternity services back online.
And the thing is, if you want to have these towns being lively, then we need to have people who are prepared to live there to do all the jobs that are available. If it's not attractive for families, people just won't go there. Queensland's now got the dubious distinction of being a first world environment where infant mortality and maternal mortality are on the rise. What can be done to turn this around?
Well, there's a few things. Obviously, have a look and invest in our rural, our regional areas, because these communities are actually the ones that prop up our economy. Like, the exports coming from these communities is huge. But we've also got Medicare that is so underutilised. We've got Medicare for midwives that's sitting there, that has been sitting there for years. Let's start getting the MBS items sorted so we can have private midwives out in these communities. We've been saying this for a long time. This isn't something new, but it certainly needs to be looked at. And we also need to stop having this all or nothing. Either we have doctors or we have no services, because we know that midwives are quite capable, and we also know that just like for any emergency in that hospital that has the capability to transfer, that we should be doing that for maternity services as well.